Hi folks, Nick and Zoe here from Gardendale Acupuncture and Chinese Herbal Medicine. Today is part 2 of a 3-parter on a condition known as Polycystic Ovarian Syndrome, PCOS or PCOS. In the previous video we talked about what it is, so if you're really interested in that, flick back and have a look. But today what we want to do is talk about how it presents, what are the symptoms. And Zoe's going to take it away.
So we'll basically continue from where we left off in the last video, which was where we discussed the diagnostic criteria for being diagnosed with polycystic ovarian syndrome. So these criteria kind of outline the symptoms you'd expect. So number 1 was polycystic ovaries. So this doesn't really present physically, I guess, that someone would see, but it's essentially on ultrasound. It looks like there's many little cysts on the ovaries.
Yep.
So that's one thing you might expect.
You don't have to have that though.
You don't have to have that to have the syndrome, and you can have these cyst-like presenting follicles on your ovaries as well and not have the syndrome. So there's a bit of grey area there, but that is one thing you might expect on ultrasound. So not the biggest deal basically on a day-to-day basis because it's not a concern. Mm-hmm. Number 2 is irregular cycles. So that in itself kind of explains it.
Yep.
Irregular periods. So really short cycle, really long cycle, or a fluctuating cycle.
Can complicate life a little bit.
It can. And when we talk about cycle, we mean that time between the periods, not the length of the period necessarily. So it's, if you're constantly waiting to find out when your period's coming, you don't know when to expect it, that can, one, impact fertility for trying to get pregnant and your ovulation. Sure. And just make life a bit tough when you're trying to plan ahead and get organized.
Have a life.
Exactly. Yeah. The third one is androgen excess, which, as I mentioned, is that excess in the androgen hormones. It's a group of hormones, essentially, but it's those male-dominant hormones that we expect that, such as testosterone, occurs naturally in females, but we don't want it to be in excess. So when that is presenting, common things that we find are hirsutism, which is that excess hair growth. So commonly on the face and the chin is excess hair. Acne is also a common one that can come from that. Often it's cystic acne as well. Doesn't have to be, but anywhere on the face usually. Yep. Commonly chin as well.
Along that jawline. Yeah.
Exactly, that jawline sort of sign, but it's different for everyone. Yeah. And as mentioned as well with the irregular cycles, you can have different symptoms at time of ovulation. Some people don't ovulate. Some people can have cramps mid-cycle as well as during the period. And also there can be some sort of insulin resistance, which is that blood sugar glucose regulation. So that might present as excess weight gain, an inability to lose weight, those sugar crashes at about 3 p.m. where you just feel exhausted, and also mood swings, feeling really emotional, moods up and down, irritability, frustration, which I think also is not only a symptom, but sometimes can occur when you're experiencing all these other symptoms on a day-to-day.
It can make the day a little tough.
Exactly. And there are things that impact people on a day-to-day. It's not just at the time of the period, once a month.
And it's not just a condition that affects you for if you're trying to get pregnant, for example.
Exactly.
It can be impacting all the time.
Exactly. And when it comes to fertility, it's more so the impact it has on ovulation. Right. Whereas it's just the impact of it on the cycle in general and the quality of life in the end. And that's, I think, the biggest impact these symptoms can have.
And the flow-on effect of that.
Exactly.
Okay, so next part 3 of our PCOS little vids is what we can do about it, I think. So stay tuned, folks, and we'll talk about what strategies we can implement to help. Bye for now.